A disability exam can be a great opportunity to describe your medical problems and how they make it difficult for you to work and for you to demonstrate them. But unfortunately, a lot of people miss that opportunity. And I'm going to present 7 imaginary patients, each of whom makes a classic disability exam mistake that I see regularly. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done more than I can count, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinion of the Social Security Administration or any other medical body. Although I have to say I'm quite gratified. I've been watching a lot of YouTube videos by Social Security disability attorneys recently, and I find that almost everything they say is in agreement with what I've said in my videos. Now, the first patient I'll call the storyteller. This is the person who describes every single doctor's visit in the last 10 years in exquisite detail. And the thing is, often these stories are interesting and I'd like to listen to them, but there just isn't enough time. And what's important in a disability exam is your medical state now and how it prevents you from working now. A brief description of what's happened in the past is helpful, but please keep it to 1 to 2 minutes and spend the rest of the time talking about how you're doing now. The second patient I call the medical dictionary. This is the person who uses medical term after medical term after medical term. And this presents 2 problems. The first is, some people are using these medical terms correctly, like a doctor would, but some people are using them incorrectly. They're describing something that a doctor would never use that term for, and I don't know who is who because I'm seeing these folks for the first time. Please, at your disability exam, describe your problems in your own words. Don't use medical jargon because it may confuse the doctor. The second problem is, one of the common medical terms patients use is sciatica. They'll tell me they can't work because they have sciatica. Well, I know what sciatica means to a doctor, and if a person really has sciatica, certain things should show up on the physical exam. If they don't show up, is it because the patient was pretending and making up a story? Or is it because what they're calling sciatica is a problem for them, but it's not what a medical doctor would call sciatica? The third patient I'd call the topic avoider. This is a patient who describes their medical problems very well, often in good detail, but they never get to the issue of how those medical problems make it difficult for them to work. As I always say, disability has 2 components: medical problems and how those medical problems make it difficult for you to work. You must connect your medical problems to work-related difficulties if you want your claim to get approved. The fourth patient I call the painful person, and this is a person who just doesn't understand how a disability claim works. They tell me that they can't work because they have pain. Unfortunately, Social Security doesn't see things like that. And the fact is, millions of people go to work every day with pain. Now, pain is often a very significant component of a successful disability claim, but you must relate that pain to difficulties working. It's not enough to say, I can't work because my back hurts. If you say, my back hurts and it prevents me from walking more than 10 minutes or lifting more than 10 pounds, then you're giving useful information that will help your disability claim. The sixth person I call the tall tale teller. This is the person who exaggerates their problems, and I see this a lot. For example, they will tell me that all their joints in their body hurt. But when I question them, it turns out they do have multiple joints that hurt, but not every joint in the body. I've never met a patient who had every joint in the body causing pain. For example, did you know that there are 3 tiny bones in your middle ear, and those bones are connected by 2 joints? If in fact all your joints hurt, that means you have a terrible earache in both ears. The sixth patient is one of the most frustrating, and I call them the ball of confusion. And I saw such a patient recently, the last time I did disability exams. This is the patient who obviously has a severe illness or injury, but is also pretending or exaggerating on the exam. The patient I saw recently had clear-cut signs of very serious illness. They could not be faking or acting, but they also had clear-cut signs of pretending on the exam. If they'd been honest, they'd have a pretty good chance of having their claim approved. But once I spot dishonesty, it makes it very difficult to assess what is real and what is not. And that's what I had to put in my report. I had to put, first of all, that they had obvious signs of serious disease, but also they had obvious signs of pretending. And in a lot of the issues, I just didn't know what was what, and it was impossible to tell. The seventh and last patient I called their Royal Highness. This is a person who shows up late for their exam and doesn't give any explanation or apology. At the beginning, the patient is seen by the medical assistant for measuring things like vision and blood pressure. And this patient often, after having those things mentioned, decides that they're going to have a little chat with the medical assistant, despite the fact that they're late. And when I ask the patient to please come in the room and start the exam because they are late, they get furious and blame it on me. Folks, the most important job you have at your disability exam is to show up at the right place on time. Everything else is secondary. As long as you show up on time, I can somehow try to figure out what you're trying to say and somehow figure out what's going on with your exam. But please, show up at the right place on time. I can't do that for you. If you have no transportation, for example, I see quite a few homeless people, let Social Security know in advance and they will arrange transportation at no charge to you. In my location, that's usually done by Uber. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.